Hi, my name is Brad Siff. I'm the founder and president of BioWave. This video is about how to hook up the unit and treat knee pain. When you receive your BioWaveGO box, inside the box you will find the BioWaveGO unit, a lead wire cable which connects the unit to the pads, pain relief pads. There's 3 pair in here. I've removed one of the pair for this demo, and then the AC charger that comes with the unit. So the very first thing that you want to do is charge up the BioWaveGO unit. So the port on the bottom of the unit here is where the charger plugs in, and the other end of the charger plugs into a standard wall outlet. It takes about 1 hour to charge up the unit. The LED bars on the front will be bright green as it's charging. The top bar breathes in and out, and once all the bars are lit and they are solid green, then you know that the unit is fully charged up. Once that's done, then you'll be ready to start the treatment. So the very first thing that we want to do is we want to plug the pads into the end of the connector. Either pad can plug into either connector. The orientation of the pad doesn't matter, and you don't have to squeeze the prongs, just push and it clicks in place. And we do the same for the second one. Again, either one can plug into either pad. To remove the pads from the cable, the connector purposely sticks out this far so you have something to grab onto. So you just pull it straight apart. You don't have to squeeze the prongs to remove the connector from the pad. Now we have to determine where we're going to place the pads. The pads have to be placed directly over locations of pain. So for knee pain, one of the typical types of pain conditions is osteoarthritis of the knee, and usually a patient has general pain throughout their knee. But you need to identify where it hurts the most. So if you can identify, by pressing or by standing up a little bit, or as you sit down and you can feel the pain in the knee, typically on a patient with osteoarthritis and general pain, it tends to be on the inside of the knee and on the outside of the knee. So these are the 2 locations that we're going to place the pads. But before we place the pads, we have to clean the skin. We want the skin to be as clean as possible because we need to have good conductivity through the skin so we can get the therapeutic signals right down to the pain nerves deep inside the body. So we have a damp towel. I've already put a little bit of water on this towel, and we're going to rub vigorously in the 2 locations that we've determined where we want to place the pads. Now we're going to place each of the pads directly over the 2 locations of pain. So the pad just peels off the liner. Save the liner, because when you're done you're going to put the pad back on there to store it. And the pad goes, this was one location of where it hurt, and the second location for this particular example was here. And that's where you're going to place the pads. For example, if you had chronic osteoarthritis of the knee. If you have runner's knee or jumper's knee, which is also known as patellar tendonitis, then at least one of the pads needs to be placed directly over the location of pain, and that tends to be right here over what's called your patellar tendon. It's right below your kneecap. So find that location of pain where it hurts. You're going to place the first pad in that location. Now for runner's knee or jumper knee, if there's no other location of pain that hurts, then we want to place this on the outside of the knee, kind of in the bony area here. So we'd place the second pad like this. 1 inch is the minimum spacing between the pads. The edges of the pads can never touch because you'll get a short circuit. So 1 inch is the minimum spacing. To start the treatment, we're going to take the other end of the cable and we're going to plug it into the port on the 45-degree angle here, and this can spin around, and then now we can turn the device on. So we hold the power button down. The power button's on the top of the device. The green tells you the status of the battery, and after 3 seconds it turns white. White is your countdown timer. We haven't started the treatment yet, but when you start the treatment, you start by pressing the plus button. These white bars are going to start turning off, and you're counting down, and when the treatment finishes, the intensity of the device automatically turns off. So to start the treatment, you have a plus and minus button on the face of the device. Just start hitting the plus button. You can press it in individual presses, or you can hold it down and it'll start ramping up at a steady rate. As you press the plus button, you'll see blue bars on the front of the device, and the blue bars are your intensity level. After 3 seconds, the blue bars, turns back to the white bars. The white bars again is your countdown timer. So you can see the top bar is breathing in and out, and that's the treatment has started. And the idea is here we want to increase the intensity so that the sensation you feel is as strong as possible, but still comfortable. Your body will adapt to the electrical field that's forming inside, and as it adapts, the sensation you feel diminishes. As it diminishes, you want to continue to press the plus button throughout the course of the 30-minute treatment to keep the sensation that you feel inside your knee at a steady state, strong level throughout the 30 minutes. At the end of the 30 minutes, again, the device automatically turns off, the intensity turns off. To turn the device off, you hold the power button down for about 2 seconds until the screen goes dark. If you don't hold it down long enough, it'll flash or it'll just pause. So hold it down for at least 2 seconds. The device is wearable. It has a clip on the back, and to use the clip, you press at the very top of the clip. Make sure your thumb is above where the plus button is, so you're not hitting the plus button, and you just press the clip, and then you can clip it on anything where you want to wear it. So for example, if you want to clip it on your pocket, you just press the clip and then slide it on your pocket, and you can actually walk around with this.